All right, good afternoon, everyone. I am Donna Jones, and I have the pleasure of being the president of the Chapel Hill-Carrboro NAACP. And I thank you for joining us online this afternoon on what is a beautiful afternoon outside. So we appreciate you taking the time to be with us here on Zoom this afternoon when you could be out frolicking in our beautiful towns. So thank you. We appreciate it. Today, we are going to have guest speakers from the county level, continuing our town hall series, which we started last month, in which we talked to our town officials and leaders and had a great discussion about where we are. We had a great conversation about where we are headed in Chapel Hill and Carrboro, and we are going to continue that discussion today with our county leaders to talk about where we're going in Orange County. So we appreciate you being here this afternoon. I have to share that we are just finishing up Black History Month and want to thank everyone who joined us for our plenty of programs that we had. We had robust discussions on everything from health and education. We had book discussions and many other things. So we thank you for coming together to join us as we commemorated Black History Month. And we know that we celebrate and affirm Black lives every day, but February gives us a unique opportunity to do it in a special and dedicated fashion. We also are now celebrating Women's History Month, and I am so grateful to so many of the women leaders who are here with us in our branch, in our towns, and in our county and community. We are doing our best to lead the way. And I want to just make sure I share that the 2022 National Women's History theme is Women Providing Healing and Promoting Hope. And it's a tribute to the ceaseless work of caregivers and frontline workers during this ongoing pandemic, and also a recognition of the thousands of ways that women of all cultures have provided healing and hope throughout this country. And so as we move forward with our agenda today, please consider acknowledging the women in your life and in our community who are both providing healing and promoting hope. With that, I just want to share that as we move through the month of March, we will continue to have branch discussions and committee meetings. If you have not yet joined the branch committee, now is the time to do so to help us do some of the on-the-ground work. And as we talk with our county leaders today, we look forward to your thoughtful questions and conversation with them. For housekeeping purposes, we'd ask if you want to feel free to drop your questions in the chat. We will get to those as much as possible, and we will have opportunities to follow up if we don't get to everyone's questions today. So please feel free to drop your questions in the chat, and if for some reason we don't get an answer for you today, we will be able to follow up. And for those who just joined us, just a quick reminder that we are recording today because we are doing a town hall, and so this will be available on our YouTube page after the fact. So thank you again for joining us. I am going to turn it over to our county manager, Bonnie Hammersley, to kick us off for our town hall. Thank you so much for being here with us.
Thank you, President Donna. Good afternoon, and thank you all for the invitation to come today to share information about Orange County government. It's truly an honor and a pleasure to be here today and to get the opportunity to talk about one of my passions, which is county government. I'm Bonnie Hammersley. I'm the Orange County manager. My portion of the presentation will be brief so that I can allow time for the important information that the team will have for you. I'm just going to go over some basics of county government and talk a little bit about the specifics of Orange County government. First, on the first slide here, I'd like to just take a minute to talk a little bit about this slide. I show here two email addresses, which are very important. If anyone needs to contact myself or the deputy county manager, I encourage you to contact us via email. We are available 24/7 to respond to questions and to answer any issues or concerns that you might have. And then finally, the telephone number 919-245-2300. This is a telephone number that is in the county manager's office. This is an intentional purpose of this phone, is that residents will get a real person responding to calls. So we can't say that in every department that's available, because of course, as you know, in this day and age, we've went to technology and taken advantage of technology. However, it's important that county residents have the opportunity to call. So we do have someone that answers that telephone and will direct you to your questions, whether it's to another department, whether it's to another branch of government. But this is something that the Board of Orange County Commissioners were very intent on having, so that residents did have an opportunity to speak directly to someone. So that telephone number will give you, you may get a have to leave a message, but someone will return your call very shortly, because we do have someone on that line during business hours. And then of course, there's always the Orange County website, and that is the answer from the Orange County website. And that is just informational. And if you have more questions, you can certainly contact departments or the county manager's office. So thank you. In regards to county government, Orange County government operates the government and commission manager system. Under the commissioner manager system, the voters elect commissioners to serve, and the commission in turn appoints a manager to oversee the operation of government. The manager serves at the pleasure of the commission. The goal of this arrangement is to divide administrative and policy-making responsibilities between the elected commission and the appointed manager. County government is an arm of state government and carries out the many services mandated by state and federal government. Orange County provides services to county residents from A to Z, from aging to zoning services. County government organizations exist to serve residents, and it takes a team. And the Orange County team consists of 28 departments with over 1,000 employees, over 60 contracted nonprofit agencies, 25 boards and commissions to provide the needed services for county residents. In addition, the county continues to work to achieve racial equity and advance opportunities for residents through the One Orange initiative. Following my presentation, you're going to hear about another important function in county government, and that is the budget process. The budget process is important to residents because it determines the level of services and programs that are available to county residents. And in addition, you're going to hear from some county departments today that make up the majority of the county's safety net services for county residents. These safety net services did experience, as you can imagine, increased demand during the pandemic, and county staff continue to respond to the pandemic with a positive service-oriented approach. Before I turn it over to the great team that we have here today, I want to share with you our mission statement, the Orange County mission statement. This drives everything that we do in Orange County government at every level. And our belief is that Orange County residents come first. It reminds us that Orange County is why we do what we do. And with this statement, this is something that all employees follow and are aware of and follow through on a daily basis. I'm going to turn it over to the Deputy County Manager. If you have any questions specifically about county government, I'm happy to answer. But as I said earlier, I'm going to defer some of my time to the department heads that are here today who are talking about the important services of county government. So thank you again for inviting us. I'll turn it over to the Deputy County Manager, Travis Myren. He will introduce the county budget process, and then we'll follow through with the safety net services of Orange County. Thank you.
Thanks, Bonnie. And greetings, everyone. So the Orange County budget always starts with a projection of the amount of resources that will be available for the coming year. So in total, we're projecting about $250 million in general fund revenues, and I'll go through those by category. And
I don't have sound here, but I did the speaker because last time I think you clicked here.
And then we do have also to support next year's budget, we're expecting to have some unspent funds from this current fiscal year that will carry forward to the next for a total general fund source of about $254 million. You can see the largest category here is the property tax. So this is the tax that's levied on residential and commercial property and also motor vehicles. The lion's share of it, of course, is residential and commercial property, accounting for 94–95% of the total property tax collections. Sales tax is the second largest revenue source. That's about $30 million that the county receives through 2 cents that is applied to all of the retail sales that occur in the county and sales that are delivered to households in the county. What is not shown in that part of the pie is the Article 46 sales tax, which is a 1/4 cent sales tax that is split between school technology and economic development, and then the Article 43 transit tax, which is a 1/2 cent sales tax that is transmitted directly to Go Triangle as the tax district administrator for our transit services. Intergovernmental revenue, that is revenue that's coming from other levels of government, so either state or federal sources. That about 50% of that intergovernmental revenue comes through the Department of Social Services. So Nancy Coston, our social services director, is here and will highlight some of those. Charges for services, these are the charges that occur like in the Register of Deeds office as property gets transferred, or as planning permit fees or emergency services. So every time there's an ambulance transport, there's a fee attached to that. Other revenue is primarily investment income. So you can think about the county, as the county's bank account, and early when property taxes are collected, there's a large balance there. And so we take part of that balance and invest those funds and can receive investment income from that. And then the last category is transfers, basically from other funds outside of the general fund to pay for administrative services. And as we look at how those funds are allocated, you can see that the largest share goes to education. If you put together the education slice of the pie and the education debt service, that's about 48% of the total county expenditures. We also measure the education expenses as a percentage of general fund revenue and have a target of 48.1% of general fund revenues being dedicated to education. Next, you'll see human services. That accounts for about 17% of our expenditures, and that's programs in the Department of Social Services, Aging Department, Health Department, and the library, and others that you'll hear from this afternoon. Public safety is the next largest expenditure category. So that is primarily the sheriff and emergency services. The sheriff budget is about 15 million, emergency services about 12. Community services is about 6% of the total county budget. So there you'll find animal services. That's where we record expenses associated with environment, agriculture, parks and recreation, planning, and economic development. General government is about 4.2% of the total county expenditures. So those are the basically governing agencies, the county manager's office, board of commissioners, tax administration, and the register of deeds. Support services is all of the back office. You can think of that as the back office of the county. So from facilities to finance to human resources. And then you'll see there is also county debt service that pays for capital projects that the county has borrowed for. If you take out the education component and just look at how expenses are distributed among expense categories, you can see we're highly invested in people. And so about 70% of total expenditures go to support personnel, 30% to operating expenses, and that very small sliver to recurring capital, which is just small furniture and recreation equipment and stuff like that. So we did receive a direct allocation from the American Rescue Plan Act, or ARPA. $28 million was allocated directly to the county. This is to date how those funds have been invested. This is a detailed list, but the takeaway here is 47% has been allocated to housing supports and eviction diversion programming, 43% to the broadband project, which I'll talk about a little bit, and then the remaining balance will be allocated, at least part of it, through the upcoming budget process. Our broadband project, we have $5 million reserved currently for that project. We know that there are about 5,000 homes in Orange County that do not have access to broadband speeds. They're represented by all of these purple dots. We did, as part of our prior federal stimulus allocation, provide Orange County schools with 120,000 to purchase hotspots. And then in our long-term recovery plan, this has been identified as a very high priority. Our map is not perfect, and so if you or someone else you know does not have broadband speed service, please follow the link at the bottom of the slide here, and you can add your name and address to the map. With that, I am pleased to introduce Orange County's Health Director, Quintana Stewart. Quintana. Well, maybe Quintana doesn't come on shortly.
I may not have had permission to unmute, but I've just changed that, so.
Sorry. Thank you. I got it. And I have a glare on the screen, so I couldn't see my mouse. Apologies.
Thanks,
Good
Quintana.
afternoon, everyone. Next slide. So I'm happy to give the COVID update today and share that we are absolutely moving in the right direction. The data that you have here on the slide, is representative of what was available as of March 2nd. However, I checked, and as of yesterday, when I look at our cases, our case rate is actually down. So we continue to decrease. So we're now sitting at a case rate of 65 new cases per 100,000 residents over the last 7-day period. So that puts us at, it's still a 94% decrease. And then our percent positivity, while this metric is no longer really reliable due to the fact that we have larger availability of the at-home testing, which means folks don't report their positive cases necessarily up to the state or local health department. But we are still seeing a decrease with that number. And so as of yesterday's data, we were at 4.2%. So Orange County, again, I think is to be commended for our response throughout this pandemic. We have a total of 78% of our residents that have been partially vaccinated and 76% that have now been fully vaccinated. I have to say, I believe the vaccination rate in the county is a testament to our current death rate as well. We're now sitting at a total of 122 for the entire pandemic. But to put it in perspective, we've had 2 additional deaths over the last month. And so the data on this screen comes from the state website, DHHS. And I'm using that one because that data is a little more current, closer to real time. I'm going to talk a little bit about some CDC data coming up. Next slide. So one thing I just want to highlight about this pandemic, things have shifted. Our COVID conditions are definitely different today than they were even just, a month and a half ago, certainly than they were a year and 2 years ago. So now what we're seeing is new variants that are circulating, and those variants have a shorter incubation period, more rapid transmission, but they are, for most, producing a more mild illness, so less disease severity. Again, like I said, we're happy that we have access to more tests, so many of the cases are not reported to public health, which is changing the way that we traditionally were counting the COVID impact in our communities. You may remember early on, we were focused on case count, percent positivity. So all of that is changing as the pandemic itself has shifted. We have increasing levels of community immunity across the state, and that's mostly a result of the Omicron variant that circulated here, December, January. So good, bad, and different. We had lots more cases, and as a result of that, we have some increased community immunity. And again, as I've been saying, we now have wide availability of vaccines, more treatment options, high quality masks, and testing. So lots of things have changed. And so that means our response now has to change. So you'll see CDC, state government, even local government, we're starting to shift and go to more layered and tailored types of responses based on what the actual COVID impact is for our community. And that doesn't mean necessarily just the entire Orange County community, but even a different response for smaller sectors of our community, like our school districts, our healthcare sector, long-term care facilities. So with that, we're seeing some changes in the reporting and surveillance tools that we're using. So now we're going to start to rely on our wastewater reports. We're fortunate in Orange County to actually have a monitoring site here with our Owassa plant. And so we can look at the water to figure out how much COVID is in the community just by looking at the wastewater. We're looking at the ED visits continuously to see how many people present to the ED for COVID-like illness. And then, universities, they will continue to do the genomic sequencing testing so we stay ahead and know what variants are circulating out in our community. Again, community resources, testing is more widely available, far, far different from where we were back in mid-January. Again, we got more treatment options. DHHS announced maybe 2 weeks ago that they were no longer limiting some of the COVID treatment options to those with high risk of disease severity, but it's now open up. So if you're eligible for that particular treatment, you can get it. You don't have to just be high risk to be eligible. And then, of course, we have lots of masks available in the community. We did a pretty big drive, I think, throughout the entire community, not just public health, but DSS, all the different towns, community partners, some of our churches, coalition partners. As we received some of the N95 masks, we did a great job of sharing and getting it out so that you all can help us get it out to community members. And then again, for public health, our biggest champion, the biggest tool that we have, most effective, would be the vaccination and the therapeutics. Next slide. And so back on February 25th, a couple of Fridays ago, CDC made a big announcement. And so this goes along with the shift in our response efforts, our surveillance reporting. But they made a big announcement where they changed their guidance on community masking. So they're relaxing the mask guidance for communities where hospitals aren't under high strain. Previously, as I said, CDC used the metrics that include case counts, case rate, percent positivity to determine your community transmission level. So now we are transitioning and they're using a different set of metrics. So now they're looking at 3 things. They want to look at our new COVID case rate over a 7-day period. They want to look at new COVID-19 admissions per 100,000 at the hospital. And they're also looking at the percent of staffed inpatient beds occupied by COVID-19 patients over the last 7 days. So this framework, again, is the attempt to start to look at factors that reflect severity of disease in the community. And we hope this will help us determine how badly COVID is actually impacting our community. Next slide. I apologize for the noise. I promise I scattered this spot out for an hour before this time, and it was so quiet. Travis, can you go back one slide? I want to share the CDC numbers. Right. So this slide also I presented early part of the week to just tell you what our specific numbers were for these new measures that CDC now has out. But these numbers also continue to improve. And so as of this morning, I looked at the data, and for Orange County, the first indicator, percent of, the case rate for cases over 7 days, it was at 142. As of this morning, we're down to 128.64. So still well below 200, which is the goal. When I look at our new COVID admissions at the hospital, per the CDC site, it was at 15.2. This morning, it's at 12.1. So again, moving in the right direction. And then we look at percent of staff inpatient beds by COVID patients, we get an 11.2. It was at 11.6. So you can see clearly, and now officially on the CDC site, we are ranked in the medium category. And we were heading in that direction. We felt confident after talking with, community partners, hospital partners, that that's where we would be. And that is part of the decision-making supported by the elected officials, board chair and the 3 mayors, when they decided that maybe it's time to relax our countywide indoor mask mandate. So again, we're moving in the right direction. There will always be a discrepancy between the state data, which they show from DHHS site, because that data is more current, more real time versus what we see at the CDC. So I just wanted to point that out because you'll see 2 different data sets here. Next slide. And so while I have an opportunity, I just wanted to briefly highlight the fact that Public Health Department does far more than just COVID response. And so here's just part of our brochure to remind folks that we also have a fully operational dental clinic. The brick and mortar building is located in Hill-Carrboro on Tryon Street. We did procure a mobile dental unit right as COVID hit back in 2020. So we've not yet been able to get that one out on the road and fully operational, but it is parked at the Southern Human Services campus, and we see patients 2 days a week, on Tuesdays and Wednesdays. And so as things get better with COVID and out in the community, as we get staff back up, because we do have some vacancies, we're looking to take that mobile unit out to serve the community and take the service to them, as opposed to community having to come to us. You know, transportation is a barrier for many in our community. When we look at our children with regards to dental, sometimes it's a challenge for parents to get off work to bring them. So we want to fix that and make it more accessible to all. Our environmental health division has been busy. They've never stopped. In spite of COVID, they were instrumental in our COVID response, but they continue to regulate and inspect and make sure that many of the services we enjoy are safe. Our restaurants, our food and lodging places, environmental health continues to do that work. We have our health promotion education section. They continue to offer nutrition classes and counseling. Tobacco cessation has really ramped up during the pandemic, so we're still offering those services. Even in the virtual platform, still able to educate and reach lots of folks. Next slide. And this is just the inside to also highlight some of our other services. So here we talk about our some of our personal health services, to include our medical clinic. We have a pretty robust family home visiting program that includes some pregnancy care management programs, child care coordination for children, and our Family Success Alliance program. Very happy that Family Success Alliance is coming back on board. We lost several staff right before the pandemic, during the pandemic. So happy that we've been able to hire a new director. 4 new navigators were onboarded last month. So they are ramping up and getting back out there, picking up their caseloads to help our families as well. Next slide. Just a few Another key initiative that the health department is kind of facilitating, the Orange County Opioid Task Force. The task force originally formed fall of 2019, and then like everything else in the world, COVID hit and everything was kind of put on pause. But that group has gotten back on track, and we had our first meeting in January. And one of the things that we're working on is updating our priorities to make sure they're still aligned with the NC Opioid Action Plan, and meeting with community partners to determine how best to use the pending opioid settlement funds. Orange County is due to get a little over 6.8 million over the course of 18 years. A lot of that money will be front loading, meaning we'll get more in the beginning and then it'll gradually decrease. But at this point, we're just awaiting final agreements. We don't have a specific date unless Commissioner Green hasn't updated knows more. But we don't have a specific date or when we will expect the funds. And like I said, we're waiting to get the agreements finalized. The task force will work with county managers, county commissioners, and the county manager to figure out the logistics of the fiscal management of this settlement. But we're excited and ready to get back to doing some of that work. And then last slide for me, just wanted to highlight some of the equity work that the health department continues to do. We are part of the larger One Orange GARE team that Manager Hammersley mentioned in her opening remarks. But COVID really allowed us to really put into practice many of the things that we've trained and prepared for. Health department staff, our team, and many of our partners well aware of some of the health disparities that exist. COVID exacerbated that, highlighted it some, but we were able to really put into practice all that we talk and train about. We always prioritize making sure that information is accessible. So we really try our best to translate all the communication that we push out in the 8 different languages spoken throughout the county. We did lots of planning with the human service group. So that was many of the human service departments in the county, many of our community partners and coalition partners to really figure out where do we need to go, who has the need. So we had lots of mobile vaccination and testing clinics that were put into place, not because of our planning alone, but because we heard from the community and they helped us get out into the areas where there was some accessibility issues. Did a lot of street outreach. I know several of my staff and temp staff we've hired got to work with Caitlin's folks and some of the folks from housing, just to also make sure that our homeless population did not go, forgotten. And so we too wanted to protect them and equip them with services and education. And then our Board of Health has a health equity subcommittee. And so we're starting to get our subcommittee work back on track and focusing on some of the work with that from the Board of Health's perspective. Thank you.
Okay, I think there it goes. So I'm Nancy Coston. I'm the Social Services Director. I'm really glad to be here to be able to share some of the things that we've been working on and to ask you to help us get some of the information to more people so that we can try to serve even more people as we move into the recovery phase from the pandemic. I thought I would just show a slide with some of the programs you probably already know we have, even though I'm going to talk about all of them today. But I know a lot of people know we do adult protective services and child protective services and foster care and lots of those programs. And nothing changed during the pandemic. We had to continue to do all of those things. So that kept on going, but it did with lots of additional challenges for how do you go into people's homes? How do we keep everybody safe? But I think we did a pretty good job of getting through that without anything bad happening and taking care of our families that needed us during that time. But today I really wanted to focus on some of the programs that really can help our families recovery. So, and just to give you a little bit of a baseline about things, the food and nutrition services that used to be called food stamps, which is a real, I think, integral part of how a community recovers. And I've said that to many people before, that getting as many people signed up for this program was a great way to help families get through the pandemic. And we increased greatly during this time. The federal government made some changes that allowed us to do a lot of that over the phone and not see people like we normally actually have to have an in-person interview. Some of that has been suspended. It'll probably come to an end shortly, but that allowed us to get a lot of services out. And as you can see, that's the number of households, not individuals, but those households got over $14 million loaded onto EPT cards during that last year. And part of the things that some of you also helped us with, I know, we were working with the families who had children in schools who were getting free or reduced lunch. And so there was also a special part of the FNS, the food nutrition program, that supported those children when they were at home during virtual, because suddenly parents didn't have food at their homes to feed the children that normally were getting a lot of their food from the school system. So the state was providing that through a special thing called the pandemic EBT. So that was another thing that was going on that we had to get parents signed up for. We distributed food, as many of you know, and in setting up the infrastructure to do some of that, we have now maintained some of that. So there are food pantries at both of our DSS offices, so both in Chapel Hill and in Hillsborough. Anybody can go any day and get some food from those sources if they can't make it to one of the other pantries or they can't get FNS fast enough to help with their food needs. So we have that available in Chapel Hill at our Southern Human Services building. We are also doing distributions of food, coupling with the food bank. And of course, we're still making referrals to all the other banks that are also helping people. But anyone can call our offices and ask to get signed up for one of the distributions or ask about how the best way to get food from one of the offices might be if they're in that need. Next slide. So one of the huge things that's been going on is health insurance. Medicaid numbers went to an all-time high during the pandemic. We increased by about 2,000 people during that time. Most of them were children because obviously adults are not eligible in North Carolina for most of the services. So Family and Children's Medicaid was the one that had the largest increase. Adult Medicaid only serves certain adults, as I'm sure most of you know. You have to have a disability or have to be a certain age, or in North Carolina does not allow you to have Medicaid. Health Choice is a lot like Medicaid, but it's for the sort of the next income level up, and the families pay a partial fee to also get their health insurance. But there were over 18,000 people in 2021 who received Medicaid in Orange County. And there was $106 million worth of services paid on behalf of those individuals. So it is an enormous part of what we do. I think our staff did a great job of getting all those families enrolled without having to see them all. But I think it really mattered for a lot of families to be able to keep their health care going as losing jobs is what was creating most of that need. And so the families were going through ACA and coming to us. ACA, the marketplace for getting health insurance. If you apply through that, that can send you directly to us also if it appears that you might be eligible for Medicaid. So those come automatically through the automation system to us. So some of them came through that and some came directly to us. But that's been a huge part of what we've been working on in the last year. And that just sort of reminding you who is eligible and who receives Medicaid. So these are the people who, depending on their income, may be eligible for Medicaid or another health insurance. The one thing I'll just mention before I leave Medicaid, I know many of you probably know there's a lot of discussion right now about whether to expand Medicaid. That is a conversation going on at the state level, because North Carolina is one of very few states that did not expand Medicaid. And what it's done is left a donut hole. And you are too poor to be able to get a subsidy through the marketplace, and you also can't get Medicaid. And so there is this pocket of individuals, mostly who are working, but their income is putting them too high for one and too low for the other. And it's really hard to explain that to people. And so I just think we have to keep remembering we have this group of people who are still struggling on how to get health care. Okay. All right, so another big thing that's been going on, we had extra money for energy assistance. As you probably know, people got behind on lots of things, and there were moratoriums to try to keep them connected, which was great. But the downside of a moratorium was that their bill got larger. And so the state made changes to some of the programs so that we could pay larger amounts of the bills to try to keep people from ending up with, particularly not having heat and heat. And then the crisis program runs all year. So we've been making some one-time payments. We're also still doing crisis intervention. The low-income energy assistance program that does the one-time payments, you can still apply through the end of March. And the crisis intervention runs all year. A new program was added this year, the water assistance program. And so that is another one where we can pay their water bill. That particular program pays whatever they owe to keep them from losing their water if they are low income. If they have not developed this huge, large bill, but they have bills that are due, we can still make a payment equivalent to 6 months of their water to make sure they can stabilize their water bills. We also have contracts with IFC and OCIM because we also don't want people to have to go to 2 places if they're already being served at one of those, and we help channel some of our funds through there so that people can be served where they already are being helped by either IFC or OCIM, depending on which part of the county they live in. A lot of people are familiar with our child care program. I will say the demand for child care dropped drastically as the pandemic rolled out. And I think the reasons are probably pretty clear. A lot of people did not want their children actually going to child care. And that has been pretty disruptive overall. We are now seeing that leveling back to where it was before. We only spend about $5 million in child care subsidies in a year. Our budget from the state for next year actually is higher. It's 5.5 million. So as we come out of this, we should be able to provide a lot of child care to our low-income families who are trying to get back into working and training for work. Parent fees are currently being waived for children. So if you know of a parent who needs this, this is a really good time to call us and get in child care. For a while, we were having some problems with openings, but recently parents seem to be able to negotiate that better than they could about 6 months ago. Youth Enhancement Fund is a special fund the county has that I want to promote just a little bit because we see so many problems with some of our youth that we have some funds to try to help them get into other kinds of things that would, I think, help them be connected. And we're also looking at some tutoring contracts. So whether it's camps, helping them get into a sports league, getting some extra educational activities. If you know of low-income kids that you think would benefit from that, you can call us for that, and we will try to hook up with those also. But the one I really want to push today is employment. So I will just tell you, we have lots of services to help people get employed. That program really has lost a lot of the people we were working with. For one thing, a lot of people could get a job without needing a lot of help. But I think we've also seen a lot of people leave the job market. You know, we have a low unemployment rate, and I know many of you have seen the numbers, but a lot of that is because so many people actually left, you know, looking for work. So if you look at the total numbers that are employed, that's where we really have to notice that we've affected our employers. So we have employers who really need people to come to work for them, and we want to find the people who either want to improve their ability to get a better job or who need help getting even their first job. We run a sort of integrated program with all kinds of the federal employment programs from Commerce and from local funds, but also with the state funds and for food stamp employment and training. And we work with employers with job fairs. We're doing all kinds of things to try to help them figure out how best to reach people who might be enticed to come back into the work environment. We have 2 skills centers, you all probably know. One is at Orange Works in Hillsborough. The other moved last year from Franklin Street to Europa. It is still on a bus line, so we want to promote that anybody can walk in that, and that is not based on your income. We will help anybody who's trying to work on their employability. So I just thought I'd just give a quick think about most of our programs you can get from our either coming to our locations or calling our number. Medicaid, food and nutrition, energy assistance you can also apply for them through something called ePass. So if you just put in NC ePass into Google, it will pop up. And people can apply online and not have to come in. They can even do their secure signature. They can sign up and have an email to track where they are in the benefit process. They have to upload certain things to us, or they will have to bring those to our offices or mail them to us. So these are the kinds of things that you would need if you're trying to apply for like Medicaid that's means tested. But a lot of the other programs, like we're talking about employment, you don't necessarily need all of that. And I usually get asked in most presentations, so when you say what your programs will serve, what are you talking about? So like childcare is around 200% of the federal poverty level, and then you can look at what the incomes would be for that. Food and nutrition services tends to be around 133% of the federal poverty level. So we have different programs. The age of your child dictates the Medicaid part. So I'm always reluctant to try to tell all the different things that you could be eligible at each level, because it makes it very complicated. But this gives you a feel for it. So if you're working with a family of 4 and they're at 55,000 or below, they probably could get help with some of the things they might need by contacting us. So I think that's my presentation, Travis. And I would encourage you, though, to help us find the people who need those employment services. Really reach out, have them reach out. We really want to be working on that right now.
Hi, I'm Corey Root. I'm the Director of Housing for Orange County. Really happy to be with you this afternoon to talk about the Housing Department. So I thought I would just go over the overall structure of the Housing Department and then dive a little bit deep into each of the sections. So overall, the Housing Department has expanded really rapidly, and this has all been during the pandemic. So in March 2020, at the start of March 2020, I believe the Housing Department had 11, 12 employees, somewhere around that number. We're now up to 40, and we've really expanded quite rapidly in sort of all areas. So our work is divided into a couple of different kind of groups. We have our community development group that really works on maintaining homes for folks and also providing new units of affordable housing in our community. We have a housing authority, which is relatively rare, although not that rare, because right down the road, Chapel Hill, they also have a housing authority that's part of government. But a lot of times housing authorities are these quasi-governmental structures that are outside of a government. But for the Orange County Housing Authority, it's within our housing department, which has really allowed for some exciting synergy, which I'm excited to talk with you about. The partnership to End Homelessness is now moved into the housing department as well. And the partnership works on system level work as well as now direct service work, which I'll talk about has expanded again a lot during the pandemic. And then we have a housing stability group that works to provide rental assistance and utility assistance for folks. And then that eviction diversion work, and then operates a one-stop shop where folks can get help called the Housing Helpline. So looking at the community development department first. So again, the whole goal here is to create and preserve affordable housing. And as I think all of you know, everyone knows in Orange County, this is hard and it's an uphill battle. We're swimming upstream to preserve our naturally occurring affordable housing, or NOAA, and then also to build more units of affordable housing. But to put this in context, you know, this is really definitely a triangle-wide, definitely a statewide, and even a nationwide problem, because there are, you know, a lot of forces at play here that are systemic and very broad. So we work really collaboratively with the town of Chapel Hill, town of Carrboro, town of Hillsborough, as well as with nonprofit developers and community members. In other places, in my experience, sometimes these groups can sort of be at loggerheads with one another, and there's a lot of energy spent in that kind of situation. In Orange County, in my experience, it's really quite collaborative, and I think we get better results because of that. So that's really a joy. We work with several different funding sources, local and federal. So the main sources we work with are the Home Investment Partnership Program, which is an annual allocation from HUD for affordable housing development. There are also the bonds, the Orange County bonds passed by voters in 2017. And so those programs, there was one allocation I believe in 2017, 2018, around there, and then one last year for that $5 million. But because development takes a long time, those funds are still in play currently. And then the American Rescue Plan potential is another potential source for affordable housing development and preservation. And then just wanted to plug, Orange County does have an affordable housing advisory board. And that group is very involved with all of this work. And if folks are interested in housing, we would love to see your application for that board. Moving on to the housing authority. So we have only housing vouchers in our housing authority, no public housing units. In Chapel Hill and their housing authority, they have public housing units and no vouchers. So that's sort of how that is mapped out throughout our community. For our whole housing authority, we have 643 vouchers currently, and those are 88% leased up. There are several years where we didn't issue vouchers, but starting in October 2020, we began issuing vouchers for people exiting homelessness. And this was a great collaboration, all sort of intra-housing department collaboration between the Housing Authority and the Partnership to End Homelessness. And since October 2020, we've issued 164 vouchers for households exiting homelessness. Of those, 104 are leased up. And we are finding that, it's taking folks quite a long time to find units. So folks will have vouchers in hand normally for many months. So our average lease up time now is just over 3 months, which is slightly down, which is we want it to go this time to go down for folks to be able to lease up quickly. And the median is also a little bit down from previous month, but you can see there that we have some folks that are with the median lower than the average. We have some outliers of folks with very long lease up time. So we're working now to, right. Thank you for this question. Sorry to be jargon speaking. That's not my goal here. Leasing up means, yes, someone has signed a lease. Exactly right. And sorry, yes. So people, these housing choice vouchers are pay a subsidy, pay of someone's rent in any market rate unit in town. Well, that meets certain stipulations. I shouldn't say anyone. There's lots of HUD red tape on all of these things. But when someone finds a unit that matches all the rent amount and the unit size and that kind of thing, once they sign the lease, we say that voucher is leased up. So we're then paying rental subsidy each month for that. So now going to the Partnership to End Homelessness, again, looking at system level work first, and then we'll kind of drill down into the direct service. The overall news is that homelessness is increasing. So we've seen a 39% increase over the last 5 years. And, there are a lot of reasons for this. Many of them are COVID related. We've seen a really big increase in the number of folks that are presenting for services each month. And we have a system that that helps us coordinate this work. And it used to be about between 80 and 90 households at any given time would be connected to a service provider experiencing homelessness and working on housing. Now that number is about 200 households. So it's it's a very large increase, and one that we're really concerned about and continuing to monitor. We know that we have gaps in our homeless service system as well. We were, I'll talk in just a second about how we've filled some of those gaps since we first started talking about gaps. But our current gaps,
I can't tell if it's just my screen or can folks hear me?
I think it might be on Corey's end.
Okay,
Yeah, he's frozen.
okay, thanks.
Should we move on to our next speaker and come back?
Guess that's me. Can you all hear me?
Yes.
All right, so I will just move forward. There was about to be some intersection between the work of the Criminal Justice Resource Department and Corey's Housing Department. So I look forward to getting back to her so she can speak about the filling the gaps in the homelessness services. So, but that is my phone number and email, and I am going to give you just a very brief overview of some of the work of the Criminal Justice Resource Department. There is so much more that I would love to share and have shared in the past and would love to come back and share, but want to look at some of the things that have really ramped up as a result of the pandemic and become priority programming for us. We're embedded in the courthouse, with the exception of our local reentry council and the street outreach program, the street outreach program is in downtown Chapel Hill, and our local reentry council is in the health department building at Whitted. But the rest of us are embedded in the courthouse. The mission statement is long and wordy because we do a lot of different things. I'm not going to read it out to you, but in essence, what we do I think is pretty unique, and that is that we serve justice-involved individuals who are at risk of justice involvement, and those who are in the justice system, and those who are exiting the justice system, either through a sentence or returning to our community from incarceration. So we do everything from trying to divert people from our criminal justice system, reduce our pretrial population, serve people more therapeutically if they're in the court system, divert them from the court system, look at alternatives to incarceration as sentences, providing all sorts of clinical services to people, and just trying to mitigate the harm that we know that the criminal legal system can have on people in our community. Our programs are the pretrial services program, Ted Dorsey, many of you may know. We have 2 substance use treatment courts, one for parents and guardians who have lost custody of their children. The other one is our recovery court, and that's for folks who were in the criminal justice system facing incarceration, and they do a treatment program through a court program that meets twice a month with intensive case management in lieu of incarceration. We have our local reentry council, which I mentioned. We have 3 diversion programs, and I'm going to talk a little bit about them because we really expanded that programming recently, and I think that's been critical during the pandemic to keep people out of our criminal justice system or criminal legal system. We have 2 clinicians, 2 wonderful clinicians, Tammy Pfeiffer and Allison Zirkle, one who works with adults and one who works with youth that are at risk of justice involvement or are justice involved. And we have an attorney position, the Restoration Legal Counsel position. I think Emma has spoken to you all at prior meeting, but her work is really restoring people who have been harmed through inability to pay, through driver's license revocations, trying to do expungements for people. It's been an amazing position that has served a lot of people in need in our community. And then finally, the street outreach, harm reduction, and deflection clinical coordinator, and Corey's going to talk more about that program, but the clinical coordinator is a member of our department, and we share oversight of the street outreach program. So next slide. So, you know, when I say unique, we are different than a lot of criminal justice resource departments. That there are about 5 others that exist in the state, but our commissioners really looked at creating this department specifically to enhance the services that were no longer being supported by the state, and also to really focus like a laser beam on reducing unnecessary pretrial incarceration. And by that, I mean incarcerating people because they aren't able to pay a money bond, but they really don't reflect or represent danger to the community, or are not going to appear in court. So those are the 2 statutory reasons that we're supposed to be incarcerating people. But what we were seeing was we often had people in our detention center who had just a $200 bond on a failure to appear on a misdemeanor larceny. Those people did not need to be in our detention center. So I think you heard a little bit at your last town hall from some of our judges who have worked with over the last 2 years to really address the urgency of reducing unnecessary pretrial detention. And we now have a new bail policy, which we're really proud of, that we've worked as stakeholders to create. And I think it's also really important to mention here that the community has really driven a lot of the support for the work that our stakeholders are doing and that our office is doing by their interest in reform. We've had some wonderful task forces, the Chapel Hill Task Force, the Carrboro one that is just starting, and the Hillsborough Task Force, that have all looked at, you know, ways that we can do things differently. And the pandemic created an urgency that we knew already existed, but has really enabled us to take on a lot more of this work with funding resources that have come in to support people disproportionately impacted by COVID, and our justice involved folks are disproportionately impacted by COVID. So those are some of the areas that we look at and try to work constantly in. Our diversion programs are something I really wanted to highlight today because we have dramatically expanded them over the last year. So in addition to the street outreach, harm reduction, and deflection program, which one piece of it is deflecting people experiencing homelessness from law enforcement encounters, and de-escalating law enforcement encounters with people experiencing homelessness. We also have these 3 programs in our office, and I'm not going to go into each one of them. They're different, but OCPAD in general is the program that we've had for the longest period of time, and that serves first offenders, people who are having their first contact with law enforcement. They're diverted from the criminal justice system. They're never charged with an offense, and they are sent instead to work with one of our social workers who creates a service plan for them that's no longer than 90 days, that's tailored to their individual needs. And then at the end of that time, if they've complied and followed through, then there never is a criminal charge. So they never have that collateral consequence of a criminal charge on their record. That program has been very, very successful. 97% of the people that we have served have successfully completed the program. But one of the things that we really noticed was that we were serving a lot of UNC students, a lot of people who haven't had disproportionate policing. And as a result, we were serving a disproportionate number of white individuals and students. So we really wanted to expand our diversion from the criminal justice system for people who have had prior justice involvement, who have been policed before, some of whom have come in and out of the system regularly for low-level offenses, primarily because of their homelessness or behavioral health issues. So we created applied for a grant, and were able to get the Lantern Project underway this year. And the Lantern Project is meeting people where they're at. It's working with law enforcement agencies to deflect so that they're not charged with an offense for low-level offenses. And also with the district attorney's office for cases that do get charged, but then can be diverted away from the criminal justice system. So similar model to OCPAD in that's about a 90-day plan. But the real difference here is we're working on harm reduction. We're working on providing trauma-informed care. We're working on peer support. We're working on just meeting people exactly where they are. So it may be that it's not about abstinence for this person. It's about a naloxone kit. It's about understanding the resources that are out there that we can connect them to. So it's really an opportunity to work with some of our higher risk folks in the community who are truly impacted by barriers involving behavioral health and homelessness. So that is a really exciting new program, and it's been wonderful to have the support of all of our law enforcement agencies here in using that program. Again, it's led by a social worker with a lot of experience working with justice-involved populations. And also our district attorney's office, like I said, has been a supporter as well. And then finally, the youth deflection program is something we used to have MDP, which some of you have probably heard about, which was served our 16 and 17-year-olds by diverting them from the adult system. Now that Raise the Age has passed here in North Carolina, there was no need for MDP anymore, but what we were realizing, and this was something that some of our law enforcement folks really talked to us about, we were sending now all the youth 17 and under who committed an offense, even a minor offense, to juvenile justice, who may divert it or who may send it to court. But not every youth needs to go to the juvenile justice system, and there are collateral consequences with going to the juvenile justice system, as we know. And so now we've been working with our law enforcement agencies to deflect and divert altogether from the juvenile justice system 17 and under folks who don't really need the intense services of the juvenile justice system and can be really assisted with immediate intervention and some collateral consequence education and some direct intervention with services. So Tammy Pfeiffer, who many of you may know from founding Boomerang, is our social worker leading that program. So excited about all those. Next slide, Travis. So this just gives you an idea of how much we have ramped up that deflection and diversion work. This is compared to fiscal year 1920, we had 113 people we were able to divert from the system, largely through OCPAD. And now this year, just July through January, so still a lot more of the year to go. Already 258 people have been diverted in those 3 programs. So we hope those numbers will continue to increase. But here's what we're trying to address. Here are the racial differences and disparities that we see in Orange County. So that first line is, of course, our population demographics. And our next line in the middle there is criminal cases that are charged. And you'll see the disparity right there. I mean, 40% of those charged are African-American, despite being only 10, 11% of the population of Orange County, 46% white. And then this last piece is a piece that we've really started to focus on, particularly during the pandemic, and that is missed court appearances. Those cases tend to have really unfortunate consequences, because when you miss court, you typically get an order for arrest. And when that is served on a person, they end up in our detention center, even for something as minor as a simple trespass case. So what we're seeing here is a disproportionate number of African Americans are failing to appear in court, getting those orders for arrest. And so we have worked really closely with the Pew Charitable Foundation and the School of Government's Criminal Justice Innovation Lab to really look at non-appearances and how to change that. So if I can get to the next slide, that we're going to have a lot more information about this non-appearance project and the work that we're doing as stakeholders to address non-appearances. But these are some of the things that we have prioritized. And I think what we're going to see, our bond policy has addressed this to some degree, but we now have transportation available through the Bail Bond Justice Project support and also from our transportation department. We have access to an Uber account. We have free bus passes. We have we're going to send out Palm cards, which are notes that when an officer issues a citation, it tells them how to get to court if they have barriers to getting to court, how we can help them. Anyways, a lot of different things that we're going to do to really try to not only increase the court appearance rate, but also to reduce the disparities that we see in that and the barriers that we know exist. Because our courthouse is in Hill-Carrboro, the population lives all over Orange County, primarily in the southern part of the county. So next slide. So the other thing I wanted to really highlight in this short time here is the crisis diversion facility. I think probably many of you have heard that there are some plans underway in Orange County through an offshoot of the Behavioral Health Task Force. There's been a crisis diversion facility work group working diligently under the leadership of Tony Marin Pietri, who is a NAMI member, but also a former project manager for RTI. His lived experience with the intersection of behavioral health and the criminal justice system has driven his leadership in this, but we've got a great group of people involved in this planning, and it's something that has been identified for years as a critical gap in reducing the number of individuals with mental health and substance use issues from either our detention center, criminal justice system, or the hospital emergency department. These are not places that can serve these populations well. We know they don't serve these populations well. A crisis diversion facility that is open 24/7, 365 days a week, that has holistic services within it, including clinical services, would allow law enforcement to bring people directly there, would allow the court system to move people from our detention center to there if this is the more appropriate setting for them given their underlying issues. Next page. The thing that makes it, I think, so unique is we do have facility-based crisis, as Commissioner Bedford we have facility-based crisis at Freedom House, but it does have some very significant barriers to serving everyone. This facility will serve everyone. There's no wrong door. Anybody who walks in or law enforcement brings will be able to be treated there either on an outpatient basis, or there is going to be some crisis facility beds at this location. There's a lot more information about the specs of this facility that I would be happy to share if you haven't already seen them, but I can send them to the branch so that they can send it out. But it has, I think, an important aspect of it is it will have social service networking, peer support within the facility. So anyone who comes in will also be offered services related to if they're experiencing homelessness. The Partnership to End Homelessness will be there, health insurance enrollment, assistance with transportation, but most importantly, linking them to case management and peer support even after they leave the facility. So again, there's a lot more to this facility, but it is, I think, going to be transformative in our community. It's necessary 10 years ago. It's even more necessary now, but it will also really be a wonderful thing for our criminal justice system, because we are serving people in our justice system, in our detention center, that really should be served in a hospital setting. The benefits are clear to our criminal justice system stakeholders, to our hospital ED stakeholders, to our law enforcement. Our law enforcement folks have fully embraced this, the need for this facility, and have committed to bringing people to the facility that they otherwise would have had to charge or bring to our detention center. But most importantly, it's going to be critical to the consumers and the families of Orange County. We estimate, with a lot of data collection that we've done, that approximately 300 episodes a month could be diverted to this facility that are now being sent to the emergency room and released immediately, or coming to our detention center and being released immediately and not getting the wraparound services that they really need. So a lot more to come on this facility, but we really think it's going to be a game changer for Orange County. And as I think Commissioner Bedford also said in the notes, it will serve individuals 4 years and up. So originally it had been an adult-only facility. Given all that we have learned and discussed about the mental health impacts on our youth of the pandemic, we know we need something for our youth as well. So it is now going to be a facility that can serve 4 and up. So that is, I think that's my last slide, Travis. Is it? It is. Okay, on to Ashley. So thank you so much.
Thank you, Donna. Before I begin, should I allow Corey to step back in, or should I just start my presentation? I'm assuming silence means I should start. All right, y'all, thanks for having me. I am Ashley Heger. I'm the coordinator for the Orange County Food Council. My pronouns are she, her, hers. And if we could go to the next slide. So I don't have as much text or graphs to share today. My presentation is going to look different than the rest you've seen because the Food Council is not a direct service provider. And we are also relatively new to the county. We've only been around with the county and towns since around like summer, fall 2019. So our mission is to grow a sustainable and equitable local food system here in Orange County, North Carolina. What we do, or how we do this, is we work with community to identify issues and opportunities. We develop solutions and build connections between community wisdom and decision makers. That sounds pretty broad, and I'm going to ground it in some specifics about our past projects and then something that we are doing right now. So a past project I'd really like to highlight for you all is our Black Farmer Think Tank. The way that this started is actually through program and policy evaluations. The Food Council had been working with some boards and volunteers around the county to look at agricultural policy and grant programs. And we realized before we moved forward with some of those proposals, we really needed to have an evaluation of not only the intended impacts, but what the outcomes already looked like in this sector of our community. So after that evaluation, the major finding was essentially that there's a lack of demographic data for our farms and a lack of relationships with those most impacted or the historically marginalized farmers. So what we took away from this is you don't know what you don't know. And in order to learn more and get closer to the solutions, especially when we're thinking about framing our food systems work, really centered around equity, we needed to get to know the folks on the ground every day doing the work. So the top recommendation from this policy and program evaluation was build relationships with marginalized food system contributors that affords them the power and space to self-determine solutions for the obstacles they're facing. We took that directly into our work with the Black Farmer Think Tank, but it's actually applied to all areas of the Food Council's work now, and I'll touch on that a little bit later. So just to go a little bit further with what this Black Farmer group has looked like from 2020 till now, we started with trusting relationships. So we went to Black farmers that we already knew and had relationships with, and we used something called the snowball method. We asked them to go and recruit people that they are in relationship with and have trust to come and participate. We then hired an outside equity facilitator or an equity coach who helped coordinate this group, facilitate their meetings, and also manage their stipends. It was really important for us when we were starting to engage in this work that we make sure this is not free work, and we make sure that we protect people's intellectual property as well as compensating them for their expertise and time. So each of the farmers participating were paid a minimum of $150 stipend per hour, and that outside equity coach also helped us manage those payments because that can be pretty clunky and difficult for large institutions to do. But it's a best practice that we recognize and we're continuing to use through all of our other programs. So out of a year of meeting and working together, there were quite a few findings, and I'm going to run through them now, and I'll be happy to answer questions later if there's time. So after a year of coordinating this Black Farmer think tank or work group, there were 4 major findings, but there's obviously a lot more to this process than I'm able to share in a short presentation today. Number 1 is that relationships are not only important, but they require time. And building relationships between an institution and individuals can be really tricky. So the way that we are starting this process is just by working with as many individuals as we can across these institutional settings, so that there's not trust in a single person, right? But trust across a number of different program areas and individual staff people and electeds, so that we can continue to become familiar with our community and the institutions that have a lot of power and authority over these spaces. The second is that things that might seem harmless can cause trust issues. So when you're talking about building a trusting relationship and not a purely transactional relationship, something like not showing up to meetings with them or delayed payments can actually cause a lot of harm. So that was a big lesson for us. The third is there are solutions out there. We often in institutional settings like to look at simple metrics and data that show us, for example, there are X amount of Black farmers in the county, but that doesn't tell us why there are that many or how they're farming or what kind of work they're doing. And when we build these kinds of relationships with subject matter experts, because we do believe those most directly impacted, those experiencing these issues or doing the work every day are subject matter experts. When we become closer in our relationships with them, we get closer to the solutions. So for example, we found through this group that there's actually an extraordinary community out there finding really resilient and creative ways to farm and connect and help each other grow. So it's not just a single farmer gathering resources from the county and helping themselves, but we were actually able to see how this community and this network of Black farmers has worked together, as well as outside of that group to help start additional farms or help them find additional contracts for producing food. And one example of that I want to hold up right now is Faithful Farms, farmer Howard Allen. So anyone who's been to the Hill-Carrboro Farmers Market has probably met Howard, or I encourage you to, but he has this amazing method that I'm not going to go into too much detail about because again, it is his intellectual property, but asset-based farming and how to establish practical networks amongst farmers. He's really out there in the community doing this. And so if we as an institution aren't connected to that work and that expertise, we miss out on opportunities to invest in it because there's a real economic return. When these farms do well, we all do well, right? They are stewards of the land, but they are also providing us with very real food. And I think that necessary, like to have local food production became very clear at the beginning of the pandemic when our supply chain started to falter. And so I'll just move on quickly to the fourth takeaway from our Black farmer group was that the county government can make more strategic and equitable investments in the local food system by really working with those on the ground doing this. And there are existing frameworks to do these kinds of investments. One that we have found through our research is called it's shortened for EFOD, but it's called the Equitable Food Oriented Development Framework. And I'm happy to answer questions about that. But it's really just everything I just described, right? Finding community institutions, working directly with impacted communities, building relationships so that we're not only reversing the history of disinvestment in certain communities, but we're thinking about ways that we can be creative and benefit our economy at the same time that we benefit our equity outcomes. So I'll just quickly move on. If you can change the slide to our food access assessment. A lot of the lessons that we learned out of the Black Farmer think tank process have now been built into a food access assessment. And what we're doing here is that we're working with community experts, and we define a community expert by someone who has lived experience to conduct a food access evaluation that will inform county policymakers. And the way that we are doing this is instead of the traditional model of going into community and surveying and sometimes data mining, right? Going in, extracting information, and then taking it back into our spaces and never necessarily communicating with the communities most impacted about what we're gonna do with the data they shared. Instead of that more traditional model, we have decided to use our evaluation and data collection time to focus on the county. So we are reviewing the last 5 years of the county's budget to see where we've invested in hunger and food access. We are also then collecting all existing policies that impact food access. And we have made this pretty broad, not just specific food-based services. We have modeled our policy criteria after the social determinants of health. We basically transitioned that to the social determinants of food access. So our data collection process for the county involves looking at our transportation policies, housing, food and nutrition, emergency services, agricultural food production, and so on. we are gathering all of that data right now, and we are working with community experts who are from day one advising our research team on how to do this. And then what we'll be doing next month is actually working with a cohort of about 12 community people, community experts who represent the most impacted communities when we consider the disproportionate burden of food access and hunger. And that includes members of our Black community, Latinx, immigrant, and refugee communities. This isn't everyone, but it's a start for us. And in that cohort of 12 people, they will go through a series of 3 sessions where they will analyze the data we've collected. We'll capture their analysis, share it with them, and from there, they'll start developing recommendations for decision makers in the county. So really what this is we started with asking ourselves, who gets to make decisions for whom and how? And the second question we asked ourselves before starting this assessment is not only how many people are hungry, but why? And those are the 2 sort of foundational questions for why we've chosen the methodology we have. We want to transition the sort of power dynamics of who gets to make those decisions to those who are most impacted. So we're starting that process with this assessment. And the benefits of this is not only having some clear data and analysis and actual real recommendations for our policymakers, but this is also a part of the relationship building process, right? This is us putting our money where our mouth is, because every single one of the community experts involved in this food access assessment are being paid. This is not free work. This is not us extracting data. This is us saying, we trust you, we believe you, we think you know your experiences better than we do, and we just want to provide you with the support and resources to be able to make a bridge between this community wisdom and our decision makers in the county. Next slide, please. All right, that's just a little bit of what I've already said. So I will wrap it there because I know we're at time, and I appreciate you all having us.
Can we go ahead back to Corey's last few slides and then go ahead and open up for questions?
Thanks. Sorry to have internet issues. So I think I was on these gaps when the internet went out. So it would be an additional $2.7 million annually needed to fill the homeless system gaps. One of those gaps I want to loop in is the crisis diversion facility that Cait was mentioning in her presentation. The next slide shows a little bit of good news, which might be a nice respite in the middle of all this other challenges we're facing. But we're in addition to seeing more people presenting for services, we're also housing more people, which is great. So last year was our best year ever. We housed 145 households exiting homelessness into housing. That's more than the previous year, and then we've just sort of been building each year. And since we started this process, which the jargony term for this is coordinated entry, we call it the home committee, or how people basically connect to services. And this happens in coordination with all the service providers in Orange County. So since 2012, when we started this process, over 400 households have been housed through that. So we're continuing to improve on these good practices as well. Looking at direct service work, we started some direct service work in 2018 with the Housing Access Coordinator, who works directly with landlords and property managers to make more units available for folks exiting homelessness, for folks at risk of homelessness, and that kind of thing. But 2020 really saw this huge expansion in this work. So the Partnership to End Homelessness, which is where I worked prior to being the housing director, starting that a couple of months back, was 1 employee in March 2020, and now we're up to 12. in the Partnership to End Homelessness. So we've also started a rapid rehousing program, which is short-term rental assistance and services to help folks get back into housing. Also started some homelessness prevention and housing stabilization work for folks in that sort of at-risk category. And then Cait mentioned this as well, the street outreach, harm reduction, and deflection, our SORAD program is a partnership with the Criminal Justice Resource Department and the Housing Department. And this group works strictly with folks that are living unsheltered. And this has been a real game changer in our community to have this program focusing solely on this group and really being able to provide some great services. So we're thrilled to have this direct service work happening as well. Another thing that started in 2020, and again, just so happened we were going to do this in March 2020. And then this other thing happened at the same time, but we're glad that it happened because there were so many housing problems that came about during COVID. But the housing helpline launched in March 2020, and we have very high volume on that. So served over 4,000 households in 2020, over 6,500 households last year. We're up to about 100 calls a day currently. So we're still seeing very high volume, but want to make sure that everyone's aware that if there are any housing needs, we have kind of a one-stop shop phone number or email address that we can get started. You can also connect with folks and making sure that folks are connecting to all the services and potentially financial assistance as well that could help them. The last thing I want to talk about is the Emergency Housing Assistance Program. So this is a program that the county administers, and it's funded in conjunction with the towns, and also the policies are made in conjunction with the towns, and then the county administers for all of the jurisdictions. So this program, again, it was sort of underway pre-pandemic, and then we were ready for prime time during the pandemic. And since March 2020, or I guess this is since January 2020, there was a little bit in January and February provided, but it ramped up incredibly in March 2020. Almost $9 million in rent and utility assistance has been provided to over 2,000 households, 2,000 unique households. Some of those folks have accessed the program a number of times, but that's a deduplicated number. You can see the vast majority of that are folks living in Chapel Hill, the next amount in Hill-Carrboro, and then in the unincorporated parts of the county, and then also in Hillsborough. So looking at the incomes for the folks that have been helped, by and large, we're looking at folks that are at what HUD calls extremely low income. So we use this figure in housing land called the area median income, or AMI. And at 30% of area median income for one person, that's $18,150 per year. For a family of four, $25,900. So over 75% of the awards have been made for folks at those low, or what HUD would call extremely low income levels. And then you can see another 20% for folks at the 50% AMI area median income. That's $30,000 for one person, $43,200 for a family of four. And then a bit at the 60 and 80% AMI as well for folks that are exiting homelessness, which is relatively rare for someone to have that amount of income, but it does happen, as you've seen. And then the vast majority, we also know that the vast majority of, well, that's not the right way to say that there are disproportionate numbers of folks who are Black and African American who experience homelessness. This is because of historical racism that was actually just written right into the federal regulations around housing for years and years and years. Also current present day discrimination that happens despite there being fair housing regulations to protect against that. We do see rampant discrimination in current practices in housing that we're fighting against. So understanding those realities, we're really keen to track the racial demographics of folks receiving this rent and utility assistance. And we're glad to see that the largest percentage was for folks who are Black and African American at 38%, then 19% white, 18% Latinx, and then the other racial categories, some not reported, multiracial, et cetera. And yeah, I think that's the last of my slides.
Well, thank you all so very much for that breadth of information. We do have some questions in the chat, and then we'll also use the raise hand feature for anyone who wants to voice their questions. So I'm going to go back up to the top of the presentation where we had a question about the broadband program. And that question was, are senior living facilities like Manley Estates and Adelaide Walters being included in the broadband program? Oh, let me make sure you all are able to unmute. Sorry about that.
It didn't help that I was yelling louder. Thanks, Donna. So Dolores, I wrote down the names of those two facilities. I'll have to look up the addresses, but I'll get you that information.
All right, thank you. And we did get a question about the fully vaccinated language on whether or not that includes boosters. Quintana did indicate that fully vaccinated is including either 1 shot of Johnson & Johnson or 2 of Pfizer and Moderna, and people are considered up to date is the language for those who have received boosters. The next question was about Medicaid expansion, and that question was, what do you see as the biggest need for Medicaid expansion in our county?
So I think there's lots of needs, but I think a lot of the things you've heard discussed today show you where if somebody doesn't have health insurance and they're in these need groups, they can get left out. There are lots of people, if you cannot qualify through the disability part of Medicaid, who cannot get Medicaid. And it's very hard to get, particularly people who are in the behavioral health area. It is difficult to get Social Security disability, which would be the only way most of them will be able to go into the Medicaid. But I will tell you, there's another group that we see a lot are, I'll say older given my age, but you know, they're in their 50s and 60s and have medical problems, but they have not reached Medicare age, but they need lots of primary care kind of work. They need medications, and all those are expensive. And it's really painful to have to tell them that there is not a program that's going to be able to pay all of that for them because they're too young for Medicaid and Medicare, and they're not classified as disabled. And a lot of those are our service industry people. As they get older, I mean, they didn't have insurance before, and maybe that, you know, you kind of got by, right? And you didn't have as many problems. But as you start having any medical problems, this is huge. The cost is just, well, you all know when you go to buy anything that's in the medical, it has been really horrible. So yes, there are some things that, you know, but again, you know, the UNC, all these programs at Piedmont Health, you know, they will do some of the work for you, but it is not, I don't think any of us think the same as having your own insurance and being able to pick a provider and go get services. And so Medicaid would fill that gap. I also think we would be doing more of the preventive kind of services and getting to people sooner, and our cost would be diminished, not increased, because most of these, a lot of people end up in the ER in a crisis rather than being able to have gone and gotten blood pressure medicine or working on a diabetes problem, whatever it is, and they end up in a crisis. So that and our behavioral health are two big ones. One of my personal ones is parents with children in our child welfare system who don't have insurance but need substance abuse treatment or mental health services have no way to pay. And so it seems to me we have an obligation to find a way to make that work. But I know there was another thing about coordinating all of this, like with some of the stuff Cait was doing, but I would also say with our new, you know, if our people have Medicaid and if Alliance, which has been at the table with us for planning the mental health work, I am optimistic that that could all work out. I mean, if you could get everybody Medicaid and we're all working together on this, I think we could make pretty good strides there.
Thank you for that. And thank you for addressing that coordination question. Cait, do you have anything to add to that one?
No, well, yes, I would concur with what Nancy's saying. So we refer people through this for the street outreach program. All of the programs that we use, we refer them to the Medicaid worker over at DSS. So we have pretty close contact, but also, our local reentry council, people who are coming back from incarceration, work very closely with the jobs work that goes on at DSS. So yeah, we're very collaborative in terms of trying to serve a lot of intersecting populations.
All right, thank you. We have a hand up from Dr. Stroman. I will give you the floor.
Thank you. I say this with a sense of hope, and thank you for the presentations. Some people would think that with all of our county's money, resources, that we would have much better outcomes for Brown and Black residents, and we don't. People are still harmed and people are still dying. In fact, for years, some of our disparities are worse than some of the poorest counties in our state. So what is the barrier or many barriers to racial equity in our county? Is it structural racism, a lack of genuine morality and compassion? Is it that we're not really that smart or creative? Do we lack courageous leadership and teamwork skills? Or are we just too nice and comfortable in our jobs? What will it take to have a sense of urgency and a change in our status quo in our county? So this question I ask is more philosophical. I don't imagine anyone would respond, but certainly would love to hear your thoughts. And I will also put it in the chat box. Thank you.
Any comments on that before we go to the next question? And if you're trying to unmute and can't, just use the raise hand or any emoji so I know to unmute you. I'm not sure what's happening with that. Okay, we're going to go to Dr. Laws.
Thank you, Madam President, and thanks to all the presenters. I have a question about the housing presentation as well as the criminal justice presentation. So the housing presentation, one of my questions was answered, and that was the racial and ethnic breakdown or demographics for those receiving assistance, utility, as well as housing. But I also want to know, do you have that same demographic data for those who are receiving vouchers? Because one could argue that Blacks are in greater need because they are not receiving, and this is anecdotal from just hearing people talk about not receiving vouchers in Chapel Hill in particular, but in Orange County, Black people saying that they were on the list, and we know that there are shortages or a long wait list for people to receive housing vouchers, but some saying that they were bumped because of either refugees in the area or other groups or populations that were deemed in more of an urgent need. So I want to know, is that just an assumption that they have, or is there data? Are there data that can give us a little bit of insight into that? Who's getting housing vouchers now, Corey?
And before you answer that, Corey, I'm going to just loop in because Lucy had a question in the chat that was similar. So I'm going to double that up and just add her question, which is very similar as to why folks have not had the opportunity to sign leases and what's being done to improve that. So if you could wrap all that up in your question, that'd be great.
Sure. Thank you so much for that question. That's not something that I have a slide that I can put up, but I will get that information and add that to future presentations. What a great point. Thank you. My assumption is because we've prioritized the vouchers for folks experiencing homelessness, and we do see those disparities. It's currently over 70% of folks experiencing homelessness in Orange County are Black or African American. So my assumption would be that we would have a relatively high percent of folks who are Black and African American, but that's something we absolutely need to be looking at and tracking, and will do. And I can get that information for the group next week. For folks, in housing search, so our housing access coordinator works directly with folks. So there's a number of different sort of plates to spin for that. So we need to have more units, right? So we need our community development group and working with the towns and whatnot for there to be more units available for folks. We're also now working to have the units referrals directly from our coordinated entry system, rather than folks having to go, all around to try to coordinate some of that housing placement work. But yeah, we have a structured system where if someone's, well, they can just sort of invoke it right away and say, I would like help, in my housing search, and we'll make sure that that happens. Or if someone is not, has had a voucher for 60 days and they haven't been able to find a unit, we automatically updated list, which he keeps updated of all that's in the county, and then offer individualized support. So we're really trying to address that and reduce that amount of time that folks are looking for housing, but at the same time, trying to provide more units and have more units available in the community.
Thank you. My next question on the criminal justice one, the slide showing, can you pull that slide back up, showing the percentage of by race and ethnicity, the no-shows, and I forget what the other bar was.
Back. There you go. Yeah.
Okay. So so the percentage of the percentage of the non-appearances, the percentage of the criminal cases for Blacks that are non-appear or missed appearances, do you know what that is? I see the percentage of non-appearances that are Black, but what is the percentage of the cases adjudicated or the criminal cases of Blacks that are for non-appearances, and what are those other reasons, or what are those other charges or criminal cases for the Blacks?
Yeah, so I don't think sorry, I think the slide just left, but the second slide is all of the charges, as you mentioned, and the percentage that are African American and Latinx and white, and then that's an overall missed appearance rate for all cases below. So I think what you're asking is I think it's Michelle, you asked the question. Within the missed non-appearances.
Within the criminal cases, what percentage of those are for missed appearances? So it's not 40% of all the criminal cases for Blacks. 40 Blacks making up 40% of the criminal cases. All of that is not for missed appearances, right? So I'm asking you, what's making up that? Yeah. So what percentage of those? So I'm asking for the within the criminal cases, what percentage of those are missed appearances? And so what are the other reasons or other types of cases?
Yeah, so though that last bar is all of the percentages of missed appearances in all of the cases that are charged. So 54% of all missed appearances in all criminal cases are.
Yeah, no, I understand that. I understand. I understand that. I understand that. My question is not that. My question is that second bar of all the criminal cases, 40% are Black. But what is it? Marijuana charges also in there? Missed appearances also in there?
Yes. Sorry.
That's what I'm getting at.
Yes, I'm
with-
sorry, I misunderstood the question. Those are the initial charges. So these are all charges, whether they be misdemeanor or felony, that in Orange County.
Right, and what percentage of the 40% are missed appearances, marijuana, felony, da da da. So I'm saying
Okay, so none of these are for missed appearances. So these are the original charges that were filed. So none of the second bar are for missed appearances. So now, as far as what percentage of them are for marijuana offenses, I'd have to separate. I mean, I'd have to go through. I don't have that slide, but I can go through and we can talk about. I can present some information on what exactly the breakdown of the charges in Orange County is.
Asking, it would be great for the next presentation. The reason I'm asking is also there is an assumption by just black, I don't talk to every black person in Chapel Hill, but the ones that I do, there is an assumption that they are getting charged more for marijuana and also for, I think larceny comes up a lot, for stealing in stores and so forth. And I just want to see, I think we need to see, are they getting, is there inequity in, or is there disparities in the types of cases that are being brought before? And that would be more helpful as we apply an equity lens to responding to the criminal justice issues. Thank you.
Yeah, absolutely, Michelle. There's no question that if we look at certain charges, there are clear disparities. We know that drug use is, across as prevalent across the board, if not more, in white communities. And we see a disproportionate number of, highly disproportionate number of individuals of color being charged with possession charges. Now, I will say marijuana possession, the numbers have dramatically reduced because there has been all of our law enforcement agencies have really made it a low priority. But even with that low priority, the individuals who are facing charges for that are disproportionately people of color. So yes, RDO, resist, delay, and obstruct is another charge where we see huge disparities in who gets charged. So yes, no question there. We can go through some specific offenses, but you've nailed it exactly on the head. There are huge disparities in chargings.
Thanks for that question, Dr. Laws, and thanks for your responses. I would ask Cait, if you wouldn't mind, if you do pull that data and put it into a slide, if you would just send that over to us so we can include that with some of our follow-up materials and along with today's slides. And the same for other folks, if there are questions in the chat or questions that you responded to today that you have more data on, especially as it pertains specifically to the Black community here in Orange County, if you would send those additional slides to us so that we can include that in our follow-up materials. One question that I wanted to bring up, and I know Quintana had to step away, is just whether or not we have any data around long COVID and how that breaks down, especially for by race. And so if we have more information about that, just some follow-up data on that would be really helpful. I know we're running very low on time, and so a few things I want to just open up real quick. Do any of our county commissioners have a quick add, or Bonnie, feel free to jump in, and then if any of the commissioners have anything to quickly add before we go to announcements.
Thank you, Donna. I just wanted to thank you all for inviting us today, and I hope that what you heard was helpful. We need everyone to run county government, so it's important that we have participation. I also would add that we talked about 6 functions today. We have, as I said, from A to Z, we have 22 more departments out there that do other things for county residents. And so I encourage you to contact me at any time if you need any information about any function that the county is responsible for, and I will certainly connect you with the experts, because as you can see, I'm a very fortunate county manager to have fantastic experts, a fantastic team in Orange County, and every day we work to meet the needs of every single Orange County resident, and we will continue to do that, and with your help we want to do it better every day. So thank you for inviting us. It was an honor and a pleasure to be here today.
Thank you. We appreciate you all being here with us. Do any of our commissioners want to add anything? We have 1 minute for you all if you have something to add. Anna?
Okay, hi. So I'm just very proud of the branch for extending the invitation, and I am very proud of our county staff for responding. I hope this is the first of an ongoing conversation. So I know as a new commissioner, one of the things that I freely admit to everyone is that I had no clue. I thought I knew what county government did, but I really had no clue of all of the things and the depth and the needs for community input, I think are really dramatic. And so I'm hoping that this introduction to county government is something that begins a dialogue and that we can keep talking about these issues going forward. So thanks for the invitation. Thanks all the staff for your engagement. Thank you very much.
Thank you. And I'm going to stop the recording here just so we can go into announcements.